identifying which program may be a better fit for each patient. So we're here today to talk about your mom. And it sounds like she's had a lot of changes over the last few months with her heart failure. And I'm hoping to identify what program may be the best fit for her. So I always like to start with kind of the larger program first, because there's a lot of misinformation about it. And I like to make sure you understand the highest level of care that is available to your mom, and that is hospice care. Most people think of hospice care as end of life and that somebody has to be actively dying to access this support. That is not the case. And anyone with a life-limiting illness with a life expectancy that could be 6 months or less may qualify. However, we don't have a crystal ball. We do not know how much longer your mom will be with us, and it may be months, it may be years. And what we do on hospice is continue to assess throughout her stay with us to make sure that she still qualifies for this program. At any point, if you change your mind during this program, you can stop if it no longer aligns with your mom's goals of care. But hospice is there to support your quality of life for your mom. Our focus moves away from curative measures to focus on how she as a person is doing right now. That means we're no longer trying to treat the underlying disease. In your mom's case, it's heart failure, and we know that there is no cure. So instead of trying to treat the underlying disease, we are going to be assessing her as this disease progresses to make sure that her symptoms are well managed. We do this by assigning a care team that consists of 4 people. There's going to be a case manager who's your nurse, who will be making sure all of her physical needs are met, that she's feeling good. If she has wound care or catheter care, that those things are well managed. Along with those regularly scheduled nurse visits, which how often they occur is going to depend on your mom. If she's doing really well, she only may need to be seen once a week. If she's having difficulty or not managing her symptoms well, we may come out every single day while we find out what combination of treatment support she needs to have that higher quality of life. Those visits may adjust and have more or less as she goes up and down in this process. Along with those scheduled nurse visits, there's 24-hour on-call support, which means that if something changes with your mom at 2 o'clock in the morning, you have someone you can call. Those calls can just be informational, where you are reaching out and asking for clarification about medications, or you can request those nurse visits. The nurse will usually respond and let you know when she's able to come out, as she may be at another appointment, but usually she can still get out sooner than it would take for her to get through the emergency room. The goal with those appointments is to make sure that she is avoiding unnecessary trips to the emergency room. So that's the nursing support and a brief overview of what that's going to look like. Do you have any questions about that component of hospice?
If something happens to my mother and she passes away, how fast can that nurse get there?
That's a great question. So we usually, when we think somebody is getting ready to transition, set up daily visits. So we're checking in on her regularly. If she passes away, you call our 24-hour nursing line and we will send a nurse out. Once again, if that nurse is coming from a far distance or your mother is in a distant location, it may take a little while for them to get out there, but they will come out. They will also make sure that all things are in place for your mom. So if you are ready for them to call the coroner, they can do that. The funeral home, all those arrangements will be in place so that if you would like those people to come sooner, they can. But the nurse, on average, usually can come out within a couple hours.
And then if the medication isn't working, is that something the nurse will be taking care of?
Yes, and that's a great question. If they give a medication and it is not helping with her symptom management needs, then what you would do is you'd call our 24-hour line and our nurse would make recommendations or changes over the phone. Okay? So let's say she's having pain. You give her the medication and it's not working. You call our 24-hour line and the nurse says, okay, I want you to give this dose of this medication. And if it doesn't work, call me back in 30 minutes. You give her that dose, you call back because it's not working, and that nurse may either make alternative recommendations or offer an in-person visit so she can be on site to help navigate that pain crisis.
Okay, thank you.
Yeah. The next component is the social worker that's there to take care of all of your mom's social needs. So if you need help applying for family medical leave to take time off work to spend with your mom, if you need help with transportation assistance, housing assistance, food assistance, Any resources in the community, the social worker is there to connect you to those resources. The last two team members are a hospice aide that's there to and can come out twice a week to help with things like bathing assistance. They can help change bedding. They can help manage your inventory and supplies to make sure you have everything you need to get through the weekend. And lastly, there's spiritual support that's there to take care of all your spiritual and emotional needs for you, for your mom, or anyone else in the family who could just use someone to talk to. Do you have any questions about that team?
If I need a bath aide to come out more than twice a week, is that something I can do?
So on average, they're scheduled for just twice a week. However, if there's a crisis or an emergency, there are times we can have them come out, but it's not usually routinely scheduled for additional visits.
How often will the social worker and chaplain come out?
That's really dependent on you. If you'd like them to come out more often, they can. If that's not a service you're interested in, they do not have to come out at all. However, it's something that I always encourage you to meet your team, because if it's something you're not interested in the beginning, you may change your mind as your mom's disease progresses and you do need more support.
Okay.
So with that team and all of that support for hospice, the goal is to keep your mom comfortable at home. And this means she would no longer be going to her regularly scheduled doctor's visits. Instead, all of the care would be through our hospice team and our medical director. Do you have any concerns about your mom no longer going to her upcoming appointments?
Does that mean we're giving up completely the normal care and strictly going into hospice?
Well, yes. So hospice becomes a all-encompassing care team. So we would take over all aspects of her care. So any diseases that she has that are not related to her heart failure, we can prescribe those medications and continue to maintain them. Any medications related to the diagnosis, we usually would discontinue unless they're helping with symptom management. But that would be up to your nurse to review those medications with you and discuss the pros and cons of each and why they may be kept or discontinued.
And if she were to go to the emergency room and needs certain care that you guys can provide, how would we go from there?
It's a great question. The example that I like to use is, let's say your mom has a fall and she breaks her hip. Without hospice support, you would call 911. She'd be transported to the hospital, oftentimes waiting quite a while in pain. X-rays, pain medication, blood work, and hours later, she gets told, yeah, you broke your hip. Because of your heart failure, you're not a surgical candidate. So here's some pain medication and go home, which has been an exhausting and emotional experience for your mom that may have been unnecessary. With hospice, instead of calling 911, you would call our 24-hour nursing line. We would send a nurse out. We would have lift assist come get her up off the floor if she's on the floor. And then they would do that assessment. They would be able to say, yep, she's in pain. We're going to give her this medication. We do think she broke her hip. And our care team would be able to tell you, I don't think she's a surgical candidate, and avoid that unnecessary trip. Now, you also have the right to disagree with the care team. If you know that this is something that you really want to have assessed, you can revoke hospice services to go seek that treatment. It does not create any barrier or penalty for you returning to services with our team later. So if you do choose to seek that treatment for your mom, then we would revoke hospice. You would go to the hospital to have that treatment, and then you can come back on when she returns home.
What if I can't take care of my mom and I need to put her into a facility? Is that something you guys could assist from there?
Yes, and our social worker would help with that process. So we would be able to provide you options on what facilities may meet your needs, location, budget, and other things that you might need to think about when choosing placement for your mom. Our social worker would be able to guide you to facilities that meet your needs and hopefully be able to find a good match.
What if I can't afford hospice?
So if with Medicare, there is no cost for hospice. So no copay, no deductible, no out-of-pocket expense. And that includes all the visits, the medications, the supplies, and the equipment. It would all be covered.
Oh, thank you.
Of course. Now, that's looking over hospice and what it can do for your mom. The alternative program is palliative care. And palliative care is a wonderful supplement to the care she's already receiving. So if you are concerned about her no longer going to her doctors, or it's very important for you that she continues to go to the emergency room, palliative care may be a good option. With palliative care, she would still see all of her regular doctors, but our nurse, and there's also a social worker overseen by a nurse practitioner, would be able to come do visits with your mom in her home and be able to help with 4 aspects of her care. The first one is symptom management. Tell people on average, the visits are usually once a month. So that nurse would come out once a month and be able to get information on your mom, see how she's doing, and assess from 1 month to the next if she's improving, declining, or if there are other needs that she has that they can help connect her to. They can then help with coordination of care. So they'll be reporting back to her primary doctor and saying, hey, these are some changes we're seeing. This is recommendations that we have to help improve her quality of life. Because palliative care is also about quality of life without sacrificing the curative options. However, there are limitations. We don't do blood work on palliative care. We don't with hospice either. But we also don't do things like wound care, which if you do not have home health, might be something that you would then have to take her to a clinic to go receive. So with hospice, we would take care of those other aspects of care like wound care and catheter care. With palliative, it's really just about that symptom management. The other components of palliative care are advanced care planning, making sure that all of her wishes are known and that they are written down. Advanced care plan, power of attorney, advanced directive, all of those things need to be in place for your mom. And then lastly, goals of care, making sure that the treatments that are being recommended to her are in line with what her goals are for her treatments in life. So those visits can be really impactful for people who are pretty early in their disease process or even more advanced. But we do recommend hospice if you think you're going to need nursing visits more than every other week.
If I need more of palliative care, can I request people to come out, or it's strictly once a month basis?
On average, there are times that we may send a nurse out more frequently. So if you call our line, you can usually receive a call back within 24 hours and talk to our staff on the phone. But with palliative care, you would still go to the emergency room if there was a crisis. You would still go to all of your doctor's appointments, and we would not manage diseases that were unrelated to the primary diagnosis that led you to palliative care. And do you have any other questions about hospice versus palliative care?
If my mom were to get better, is there any graduation? Can she complete and leave both programs?
Yes, absolutely. And it's common for people to jump back and forth between the two. They'll start on palliative care, and as their disease progresses, they'll move to hospice. The opposite is true. Somebody may start on hospice, and with the amazing amount of support it offers, actually see improvement. Compared to other hospice programs in our area, ours is unique that instead of cutting you off immediately with a live discharge, so she came off services, she would then not have any support. We oftentimes graduate somebody onto palliative care. So there's still some resource and regular check-ins after her graduation through our palliative care program. And they may identify down the line that she's become appropriate for hospice again.
Who makes the determination if she starts off at palliative care and then needs to be transitioned to hospice?
So we could send a nurse out to do an evaluation and can make that recommendation. Right now, because of your mom's heart failure and where she is in her disease progression, she does qualify for hospice. That does not mean that you have to choose hospice. It is up to you and your mom on what that you feel is the better choice for her. But she does qualify for hospice.
Thank you.